Hi, I'm Jim Martin. At Health Republic Insurance in New Jersey, we believe that all citizens need to be informed about the unique healthcare issues that affect their lives. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by activists in cooperation with the American Medicine Chest Challenge. Choose New Jersey. Our mission is attracting companies to the Garden State. NJIT, New Jersey Institute of Technology. Health Republic Insurance of New Jersey. The New Jersey Education Association, working for great public schools for every child. Berkeley College. And by the Healthcare Foundation of New Jersey, founded by the Jewish community. Promotional support provided by the Star Ledger, powering NJ.com, and by Commerce Magazine.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Hi, I'm Steve Adubato here at the Hackensack University Health Network Fitness Center, powered by the Giants, here with Bob Garrett from Hackensack. Bob, I got to ask you, we see this extraordinary facility behind us, beautiful sign, powered by the Giants, Hackensack. You know, you guys are partners.
Yes.
The genesis behind this, describe it.
Well, you know, if you think about it from the hospital's perspective, wellness and disease prevention is a big part of our mission. And population health management, which is a new buzzword out there.
What does that really mean?
It means really keeping people healthy and trying to avoid unnecessary medical care wherever possible. This wellness center and this fitness center really fits right into that. We had a pre-existing partnership with the New York Giants. It's been a great partnership. We've been very pleased with it, and it just made sense that two organizations that are known for fitness and wellness in different ways come together and host this absolutely gorgeous facility.
By the way, on the tour, we're going to meet a couple of the great Giants, one a player and one a top executive with the Giants. Describe who we're going to meet.
Steve Weatherford.
He's a great athlete. He's a terrific punter for the Giants, right?
Is. He's great. And Mike Stevens, who's the chief marketing officer of the New York Giants, who's been a great partner.
We got front office and right on the field.
We do.
And describe how important it is that the Giants, powered by the Giants. Why is it so important that the Wellness and Fitness Center it's powered by the Giants?
Well, the New York Giants obviously have a great reputation out there. They're certainly known as a quality football team and as an organization that practices fitness and wellness. And you know, I was really struck when John Mara was here. We had a little ribbon cutting. He said this is the first facility that has the New York Giants name on it that the Giants don't own. And I think if you think about that, that's pretty significant for the New York Giants to partner with Hackensack on a facility that they actually don't own. And I think that speaks so well of this facility, of the partnership with Hackensack, and of the mission of the New York Football Giants.
I promised you a tour. In fact, we were on the Hackensack UMC Fitness and Wellness Center, powered by the Giants tour. We're here with Bob Garrett, who you met before. And let me also introduce Mike Stevens, who is the Chief Marketing Officer for the Giants, and this guy, on my right, people know, Steve Weatherford, who is a great player and athlete, a punter for the Giants. I got to ask you, they say that this is your first stop. We're in the Child Care Center at the Fitness and Wellness Center. This is your first stop?
Well, I got 3 kids, and anytime I can involve my kids in something I'm passionate about, whether it's charity or it's fitness and health, I definitely do it. And so this is our first stop every Saturday morning. I come in here. The kids really enjoy it because they get to come in here. They play activities with the kids, get them to exercise, get them to be active. And at the same time, my wife and I can go have some quiet time in the weight room, in the cardio section.
Mike, let me ask you before I go back to the boss over here. The Giants. Bob was saying before in the opening that it's one of the few situations, one of the only really, where the Giants are involved, where they don't run the whole thing. You guys partnered up. Why partner up?
This is great community involvement. It's really the first time we've ever put our name on another facility outside of our training center or our stadium. And it's really because we just believe that it's a great way to be a part of our community where we live.
It's interesting. Bob and Mike were having a conversation as we started the tour, and he said, it's one thing to look at it on paper when they were, planning it out, but it's very rare that a fitness and wellness center or anything that you plan actually turns out to be better than the way you envisioned it.
It absolutely is incredible. And this daycare center here is so important for hospital employees as well. We have a lot of married couples that work at the hospital, and as Steve said, gives them a chance to drop their children off. They know that they're safe, they're right within the facility, and then they can do a great workout together.
Steve, set us up. Looks like you haven't really seen the gym in a while. I'm joking. Tell us what we're about to see as we go into the gym. Describe that facility, because you've been in all kinds of gyms. Describe what is special about that gym and why it isn't just for professional athletes.
Well, it's a great facility because it's got everything that you would need in order to get fit, stay fit, or improve your fitness. For me, it's got the weight room, it's got the cardio equipment. For people that are coming off of injuries, they've got a pain management center, they've got an aquatic center, they've got an athletic development center. So for me, it's all in one.
Okay, so what we're going to do is we're going to take a look at the weight room and get a sense as to what goes on there and why it's the kind of wellness and fitness center that is really for everyone. Let's take a look. This gym, I will tell you, walk in, it looks overwhelming because it has everything you could imagine, but Steve says it's not. It's very manageable. Tell us why.
Well, I think the unique place, or the unique thing about this gym is, when you come in here and you sign up and you decide to commit to this, they're not just going to give you a trainer and take you through a crazy workout or a workout like mine. What they're going to do, they're going to sit you down with a nurse, see what your deficiencies are, see what your blood pressure is, and what that does is enables them to build a strong foundation for you before you start to get stronger, improve your flexibility. You really want to see what's under the hood of the car before you start to improve horsepower on it. So I think that's the unique thing that Hackensack and the Giants have been able to do is fix problems before they occur, and it's preventative maintenance, and I think that's a very unique thing that we've been able to accomplish here, and I'm very proud of it.
It's interesting with the partnership, and Bob Garrett's going to pick up with us in just a bit and talk to us about the wellness side, which is, again, brings together, talk about balance that Steve's talking about, the training and the wellness, the fitness and the wellness side. But Mike, let me ask you, the role of the Giants themselves, talk specifically about that, because Steve talks about nurses and you got the clinical side with Hackensack involved, but the role of the Giants, powered by the Giants, make that come alive for us.
We have a range of things that we're doing. We're working with Quest Diagnostics on sports diagnostics to learn what's happening with bodies on the inside. We're working with Nikes, the Nikes of the world, on performance. We're doing flu shot programs and awareness programs with people like Dwayne Reed and Walgreens. We're working with Hackensack. With NBC, we do an expo where we open up our stadium, and we opened it to the community last year. We had 35,000 people come in for all sorts of health screenings and testing. So we're very committed to the marketplace with everything down to the youth level. Place 60, it's an NFL league-wide program, to youth programs that we customize and run in our local market. And this is an extension of all that. So our trainers are intimately involved with the programming here, consulting here, providing tips. We're surrounded by subject matter experts, nutritionists, people that really know how to help athletes and bring that learning here for the benefit of the members here.
You're talking about an epidemic in this country. The First Lady, Michelle Obama, has talked about this a lot. You know where I'm going with this.
I do.
It's childhood obesity. Steve, you got 3 kids, right? We got 4 kids. We're concerned about that too. Parents across this country are worried about it. Let's talk about this place in the context of childhood obesity.
Well, I think it's important because I think as a child, if you learn to do things correctly, if you learn the importance of exercise as a young child, you learn the importance of nutrition as a young child, you don't run into diabetes, obesity, and all the laundry list of things that you're going to have go wrong with your body as it grows older. And I think for me, I try to impress upon my kids, it's not about how strong you are, how fast you are, it's how healthy you are, because you only get one body. And I think the most important investment you can make in life is within your body. And so I think that's important because with the partnership of Hackensack and the Giants, I think it's more than just getting as many members in the door as you can. It's about really making it infectious for the rest of the community to get fit.
Bob, again, there's the fitness side and there's the wellness side. We're over here at the Deborah Simon Center of Integrative Behavioral Health and Wellness. Talk about this side of it, the wellness side?
So the wellness side is really all about keeping the population healthy, keeping the population well. And I'm talking about well in a very broad sense, mind, body, and spirit. So here we have the Behavioral Health Center, and here there are individual and group counseling sessions for folks who need behavioral health intervention. And it's a very comprehensive program. It's a great setting. It's an upscale setting. It's easily accessible, and we have trained psychiatrists, psychologists, and a comprehensive healthcare team to do those types of assessments and treatments.
But Bob, the idea that in a place where you've got people working out, people looking for nutritious food, the whole thing, it belongs all together?
It does. It belongs all together because wellness is the complete picture. As I said, it's not just about working out. It's not just about nutrition. It's about your wellness up here as well. And then on this side over here, Steve, we have a diabetes education and treatment center, the Molly Diabetes Education and Treatment Center. That's something that Hackensack has run for many years, but this moving it in here makes so much sense too. As you know, diabetes we know is one of the chronic diseases that's out there that continues to grow, and we think by having it in a wellness center like that, it'll get much more attention. More people will who are pre-diabetic will come and hopefully be educated about the disease, and they'll be able to prevent the onset of diabetes. Part of this whole wellness center is about community education as well. So there'll be programs for the community. We have a cooking studio as an example.
Hey, talk about that.
The cooking studio is great. The cooking studio is a comprehensive cooking studio. We're going to teach the general public or patients to cook and eat healthy. We're going to have chefs come in and demonstrate, some celebrity chefs, some everyday chefs, some of the restaurants up here in northern New Jersey. Some of those chefs have agreed to come and be part of it. And it's a great way to really educate people about good cooking and good eating.
It's so interesting as the national healthcare reform in place. The whole healthcare model changes, correct, Bob? We've talked about this on the air, many programs, Capital Report, One-on-One, Caucus, all of our other programs with Bob. From a public policy point of view, it's shifting fee for service,
right?
to is that what this is?
This is where a hospital in this case and is being paid for keeping people healthy.
Preventive care?
Preventive care, and that's part of what the Affordable Care Act is all about. So we think it makes perfect sense. It's a big part of our mission now, and it will become more and more prevalent. More and more health care will be delivered outside the four walls of a hospital. It'll be in centers like this, wellness centers like this, and Hackensack happens to be on the forefront of this. But I think within 5 to 10 years, you're going to see a lot more of these types of wellness centers out there.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
Hi, Steve Adubato here on the campus of NJIT. We just finished up a forum on the Affordable Care Act, the ACA, just a couple days before March 31st, where the first official enrollment period for the exchanges is supposed to be ending. So many questions. We had an expert panel. We have Darrell Terry from Newark, Beth, who's the Chief Operating Officer. Darrell, you were here, you heard some of the discussion. You guys at Newark, Beth, the leading healthcare providers here in the city, you heard the discussion, you heard the experts, you heard the folks here, but you're in the trenches every day. The ACA, people signing up, how are we doing?
We're doing okay, especially on the Medicaid portion of it.
Medicaid expansion.
Medicaid expansion, right. So one of the things I want to thank you for doing this. This is important, and it doesn't end on March 31st. The education piece has to continue throughout. People need to be educated and understand what's going on. So we have to keep the momentum going even after March 31st. I don't want people to just think that this is a drop-dead date, and it's really not. We need to continue to educate our customers and make sure that they are ready for when it opens back up again, and certainly enroll many people as we can in the Medicaid expansion. That's huge. And we've done a great job at Newark, Beth, converting charity care people to Medicaid, and really
explain how that works.
So we have financial counselors, and we work with charity care patients and turn them into Medicaid patients, and we actually pair them with a doctor. We want them to have a medical home, so we want them to have a primary care physician. We want, as you say, I'm going to my doctor, we want everybody to be able to say, I'm going to my doctor. So we really pumped up our primary care, and we're attaching primary care to these individuals to make sure that they have the same access to care that you and I have.
It's so interesting. We were talking about a lot of folks who may be saying to themselves, as we do this program a few days before March 31st, I'll just go to the emergency room. And Newark Beth has one of the biggest and most active in the city and the state. Darrell, what do you say to those who say, hey, listen, I can get health care, I can get taken care of in the emergency room, so I don't really need to go to the exchange? What do you say to those folks?
It's not the best place to get your care. Of course, if it's an emergency, you need to go to the emergency room. But for primary care, you really need to attach yourself to a physician so he can get to know you, get to know your habits, get to know who you are, what you're about, so he can really help you, so he can get to the root of it. If you go to the emergency room, you're going to see a different physician probably every time you go there, and they will be able to treat whatever's going on that day, but they might not be able to get to the root of what's going on. You really need to connect with a primary care doctor.
Gal, you know this community very well. Darrell works every day dealing in the city of Newark and the surrounding communities with his colleagues at Newark Beth. It has been challenging. I mean, for those of us in public broadcasting, holding this forum tonight, trying to reach out for people, they're on the front lines every day of providing quality health care. But what is your sense as to why this has been so challenging for so many, just say in the city of Newark, because there's so many people who are eligible to sign up, and it's been a challenge one at a time getting them on board. What is your sense as to what some of those challenges are?
Some of it, of course, is the politics of it, and there's a confusion with the rollout. It was the execution of it, but then there was a lot of...
The website didn't help.
They didn't help. It did not help, but the politics didn't help, and it's a lot of confusion, and we really just need to be out there educating people, getting them connected to healthcare, because at some point they're really going to have to look at the personal responsibility and how they can help themselves improve their health. And so I think that programs like this is very important to really get the word out, get the message out. We all have to be soldiers. We have to be foot soldiers and get the word out.
And finally, if I can ask you from perspective of Newark Beth, how do you see the hospital's role, the medical center's role in terms of providing health care in this community, and how does that change with the implementation of the Affordable Care Act?
Well, we really want to move away from emergency care, inpatient care, episodic care, and move much towards wellness.
What does that actually mean? Give me an example of that.
So we want to teach people how to take care of themselves. We want them to eat right. We want them to exercise. We want them to, if they have chronic conditions, we want them to be compliant with the doctors, whatever they prescribe for the treatment. So we really want to keep people out of the hospital, which is a shift. We've always been fee for service, and we get paid when people come in for our services.
Doesn't work anymore.
So no, it doesn't. It doesn't, because we're not really providing health care. What healthcare really is to make the communities that we serve healthier, and that's what our goal is, and that's what we're going to do.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
Larry Downs is Chairman and Chief Executive Officer of New Jersey Natural Gas. Good to have you on again, Larry.
Steve, glad to be here.
For those who do not know the organization, explain who you cover and what you do for them.
Well, New Jersey Natural Gas is a natural gas distribution company. We serve about 500,000 customers, primarily retail in Monmouth and Ocean, and a little part in Morris County.
We had John recently on Capital Report, our public policy program, talking about the folks you serve and the challenges that you've had with regard to post-Sandy. We're doing this program in the spring of 2014. But one of the things I wanted to do on one-on-one is talk to you about the question of leadership. You and I have had an offline conversation about some of the challenges post-Sandy in leadership, and some of the heroic things that took place, not just with your team, but with nonprofits in the Monmouth and Ocean community. Leadership lessons learned post-Sandy, particularly
this far out include?
Well, first thing I have to say, I'm in my 20th year now as CEO of New Jersey Natural Gas Company, and during that time I have learned a tremendous amount about leadership. I've also learned what leadership is not. It is not some abstract concept. It is not just philosophy. It's real, it's alive, and it's got to be part of your organization. In fact, I've come to view every individual in our company as a leader. It was back on Halloween of 2012, just a couple of days after the storm. We had to shut down about 32,000 customers. It was a very, very difficult situation.
It was dangerous, that's why you shut them down.
What happened was we could not ensure safety, so we had to shut it down. But I think your viewers probably remember that morning, early that morning, where the news helicopters had picked up fires that were burning. They said it was in Maniloking. It was actually in Brick Beach. And it was going to be our job to put those fires out. So that morning, our team put together a plan. And basically what we had to do, the plan was originally to come over the Maniloking Bridge. But the Army Corps of Engineers had told us that it just wasn't safe. So what our team did, they were broken into two groups, 7 and 4, and what the 7 had to do was to get a boat and basically get in that boat by the Maniloking Bridge, head south down to Curtis Point. The other 4 individuals were in 2 crew trucks, and they were following a front loader up 35. There was 6 feet of sand on Route 35 to get to the point where the fires were. Now they had 100 pounds of equipment on their back. And if you can picture the scenario, it was daylight, it was actually sunny that day, but the debris and the sand had covered everything. And what they did was to go area by area, finding those fires, digging through all of the debris, all of the sand, to put those fires out. It took them 17 hours to do that. And it was at 17 minutes after 4 in the morning the next day that I got a call from Craig Lynch, our Senior Vice President of Operations, telling me that the final fire was out. It was just a remarkable day. It is one that is still in our company today. All you have to do is mention the boat, and you find out that they know exactly what that was all
It's
about.
interesting. This is the annual report, right? 2013.
Yes. Yeah.
Take a look at this, Bob, if you can zoom in on this. You see the crew right here, right? You see that?
Yeah.
It was a good crew. That's all it says, right? But it describes who those guys were.
It was a great
They put their
crew.
lives on the line.
Well, they really did. And what was interesting is when the plan was being developed and the challenges arose, I'm the CEO of the company. They didn't call me and say, hey, Larry, what do you think we should do here? They didn't send me an email and say, do you have any thoughts on how we should handle this? There's no manual to tell them what to do. They did it. And that is the essence of leadership.
So it's interesting. Someone says, well, leadership is the CEO telling people what to do, when to do it, commanding control, managing the process, and you say?
I say that's a very limited definition of leadership. You're only successful in an organization, as I said at the beginning, if you create a culture where every individual in the company is a leader. And we talk about that all the time, but you only find out whether or not that is actually true in a situation like this.
In crisis.
In crisis, that's exactly right. Now, this is just one example, and I could give you, dozens more of individuals in the company who had to make decisions on the spot because people's health and safety were on the line. This is one very vivid example. And when something like that happens, the positive impact that has on the entire company, I can't tell you how important that is to really underscoring the company's values and the things that we stand for.
Sent a lot of powerful message to everyone else on the inside.
Absolutely.
The other thing you and I have talked about post-Sandy, and by the way, not too long ago, and we'll do this again, the Caucus Educational Corporation went down to the Jersey Shore. We went to Ortley Beach, which you know well. We went to Point Pleasant. We went to Seaside Heights. And we did a series of interviews with people who are dealing directly with Hurricane Sandy. And also we talked to not-for-profit leaders that actually your organization helped us identify. Yeah. Not-for-profit leaders who, some of them didn't even exist when Hurricane Sandy hit in the fall of 2012, yes. Right? Yeah. They were created because there was a need. What does that tell you about leadership?
Well, I mean, that was, again, the stories there we could go on and on about, but it was really built around inspiration. It was people wanting to help others. I mean, our team did an outstanding job, as they always do, and we were able to help, the large organizations that we all know, United Way. And
the Red Cross, United Way, Salvation Army, the Food Bank of Monmouth and Ocean County.
Absolutely.
But then there were some others that you didn't even know existed.
That's exactly right. I mean, there are so many examples, but for example, Project Paul, which is out of St. Anne's Parish. Project Paul. This is a group of individuals from St. Anne's Parish up in Keansburg who had a food pantry, had financial assistance, and their building was actually damaged during the storm, and we were able to help them.
What's that have to do with leadership?
Well, if you go back to the leadership definition that I use, that it's actually every individual has to be a leader. When people stepped up the way they did, nobody had to tell them what to do. They knew what the needs were, and they were able to meet those needs. I can't say enough about what the volunteer fire departments did. One that comes to mind is in Ocean Beach, down near Ortley Beach, where there were just tremendous needs down there. They helped us. They allowed us to use their facilities as a staging area. Our guys were able to rest there. And then another one it's an interesting one because it's a national organization called First Book, but is playing such an important role getting books to young people right now throughout the service territory. But in addition to all of those organizations, there are so many people that are not part of an organization that just came out and wanted to help. Those individuals were showing leadership in their own right. So it's not just the large organizations. It ultimately comes back to the individual.
Do you think, Larry, because Larry and I talk a lot off camera. I do a lot of leadership development, which off camera, that's the work that I do, leadership development and coaching, and it's a subject you and I think about a lot.
Yeah.
The Christian brothers who trained us, you at Bergen Catholic and me at Estes Catholic, that's what they tried to teach us.
Yep.
Do you think that on some level we're all, quote, natural-born leaders, but looking for I don't want to be overly philosophical, but looking for the opportunity to step up?
Yeah, I think the answer is yes. And when I think about, a personal definition of leadership, it revolves around three areas: learning, teaching, and sharing. We all have to learn new things every single day. We all have gifts that we've been given that we can teach others, and sharing, which is what I think the Sandy relief effort was all about, is sharing those gifts and talents with others. That's what leadership is all about.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, Berkeley College, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.